So my number was 23, and I got musculoskeletal. So I'm going to be washing my hands with hand sanitizer. Okay, so hi, my name is Addison Moreland. I'm going to be your student nurse today. So I'm going to be draping you with a blanket for your privacy. Today we're going to be doing an assessment of your musculoskeletal system. Can you tell me your name and date of birth?
Jagger Moreland, 8/15/01.
Okay, and there's no allergy or fall wristband. So I want you to know that everything I find today and everything that we discuss will remain confidential. Also, do you have any questions for me before we begin?
I do not.
And then also, if you have any questions throughout the exam, just stop me and I'll be glad to answer. So first thing I'm going to do is I'm going to be inspecting your cervical spine. Okay, so I see that your cervical spine is midline. There's no edema. So now I'm going to do some palpating. You let me know if there's any pain or tenderness. Any pain or tenderness?
No pain.
Okay, so there is no pain or tenderness to the cervical spine, no palpable edema, no masses or nodules, so that is good. So now we're going to be doing range of motion for your head. So I'm going to have you do flexion and put your chin to your chest. Okay, now I'm going to have you look forward for extension. Okay, and then look up at the sky for hyperextension. Okay, now I'm going to have you move your ear to your shoulder without moving your shoulders. So like so, okay? And the other side. Okay, now look all the way to the left. Look all the way to the right. Okay, so client has full and active range of motion of the head. So now I'm going to be going to the TMJ, which is your temporomandibular joint. So first I'm going to do a quick inspection. I can see that it's symmetrical. There's no visualized lumps on the TMJ, so I'm going to palpate. Any pain or tenderness?
No.
Okay, open, close, open, close. Okay, so there's no popping or clicking. There's no grating or crepitus. There's no palpable edema, no pain or tenderness. So we're going to check for your range of motion. So I'm going to have you open your mouth as wide as you can. Okay, close. Now I'm going to have you move your jaw side to side. Okay, now I'm going to have you move your jaw in and out. Okay, so the client has full and active range of motion of the TMJ. Now I'm going to be looking at your SCJ, which is your sternoclavicular joint. And I see that it is midline. There is no visualized edema. The color is consistent with the rest of your chest and your body. No visualized nodules, no bumps or lumps. So I'm going to be palpating. Let me know if there's any pain or tenderness. Any pain or tenderness?
No pain.
Okay, no pain or tenderness with the SCJ. So now I'm going to begin with the upper extremities. So I'm going to be inspecting your shoulders, your upper arms, lower arms, your elbows, your wrists, your hands, and your fingers. So I'm going to visualize your whole shoulder, your arms. Okay. And so everything is symmetric. There's no malalignment. They are the same shape. There is no areas of skin breakdown, no rashes or lesions. The consistency of the color is the same with the rest of your body. There is no visualized edema, masses anywhere. So now I'm going to do some palpating. Let me know if there's any pain or tenderness. Okay, I'm going to palpate your hands and your fingers. Okay, any pain or tenderness?
No pain.
Okay, so no pain or tenderness for the upper extremities and no palpable edema. So now we're going to be doing range of motion. We're going to begin with the shoulders. So this is without resistance. So I'm going to have you do flexions. I'm going to have you put your hands to the sky. Okay, extension down, hyperextension all the way back. Then I'm going to have you do abduction. So make a triangle above your head. Perfect. Now adduction, you're going to go all the way down and give yourself a hug. Awesome. Now we're going to do internal rotation. So like you're going to jail. And then external rotation like you're taking a nap. Okay, so now we're going to be doing it with resistance. So I'm going to have you do flexion. So first I'm going to have you put your arms out like Frankenstein. So I'm going to stabilize the shoulder joint. Don't let me push down. Again, let me push down. Okay, now you can go to extension all the way to your side. Okay, I'm going to stabilize. Don't let me push up. Okay, I'm going to stabilize. Don't let me push up. Okay, now hyperextension all the way back. Okay, stabilize your joint. Don't let me push up. I'm going to stabilize your joint. Don't let me push up. Perfect. So now I'm going to have you do internal rotation like you're doing a scarecrow. Okay, so don't let me push up. Okay, now don't let me push up. Okay, now external rotation like you're doing a field goal. Okay, stabilize your joint. Don't let me push down. Stabilize your joint again. Don't let me push down. Perfect. And now we are going to be doing abduction. So I'm going to have you put your arms out just like so. Okay, don't let me push down. Perfect. Don't let me press down. Okay, and now we're going to be doing adduction. So I'll have you go in, give yourself a hug. Okay, now I'm going to stabilize your joint. Don't let me pull this arm out. Okay. And don't let me pull this arm out. Perfect. So client has full and active range of motion of the shoulders with resistance of 5. So now we're going to be going onto your elbows. So I'm going to have you do extension like a bicep curl. Okay, extension is down. And then I'm going to be having you put your elbows in at a 90-degree angle into your sides. So push them in, just like this. Okay, now we're going to have you do supinate, so hands up, pronate. Okay, so now we're going to be doing that with resistance. So I'm going to stabilize your elbow. So right now you are in pronate, so don't let me push out. Stabilize your elbow, don't let me press out. Okay, now move to supinate. Okay, don't let me push in. Okay, don't let me press in. Okay, now I'm going to have you do flexion. So do the bicep. Okay, now don't let me push down. And again, don't let me push down. Okay, now go to extension, so at your side. Okay, now I'm going to stabilize your joint, don't let me push up. Stabilize your elbow again, don't let me push up. Okay, so client has full and active range of motion of the elbows with resistance of 5. So now we are going to move on to your wrist. So I'm going to have you do flexion, extension, and hyperextension. Okay, so now we are going to do radial deviation, ulnar deviation. Okay, now we're going to be doing it with resistance. So I'm going to stabilize your wrist, don't let me push in. Okay, again, I'm going to stabilize your wrist, don't let me push in. Okay, now go to radial. Okay, stabilize your wrist, don't let me push out. Stabilize your wrist, don't let me push out. Okay, so now we are going to do the flexion. So I'm going to have you do flexion of the wrist. Stabilize, don't let me push out. Okay, I'm going to stabilize your wrist, don't let me push out. Okay, so now I'm going to do extension. Okay, don't let me push down. Don't let me push down. Okay, hyperextension all the way up. Okay, and don't let me press down. Okay, and don't let me press down. Perfect. So the client has full and active range of motion of the wrist with resistance of 5. So now we are going to be doing the Phelan test. So I'm going to have you put your hands just like this. I'm going to start my watch. I'm going to count 60 seconds. So as you're doing this, I want you to know if, let me know if there's any pain, numbness, or tingling. And we're going to be doing this for 60 seconds. And this is just used as an indicator for carpal tunnel. So if you were to experience those symptoms within the 60 seconds, that could possibly indicate carpal tunnel. Okay, we got about 30 seconds left. Are you doing okay? Any pain, numbing, tingling?
No.
So far? Okay. 15 seconds left. Still doing okay?
Yep.
Okay. Okay, 5 seconds. Okay, you can put them down. So there's no pain, numbness, or tingling?
No.
Okay, so negative Phelan test. And now we're going to do the Tinel test. So I'm going to be palpating his snuff box right above his wrist here. Have you put your wrist out yet? And as I do this, let me know if there's any pain, numbing, or tingling. Any pain, numbing, tingling?
Nope.
Okay, so client denies any pain, numbness, or tingling, so that would be a negative Tinel test. So after that, now we're going to be moving on to the range of motion of the fingers. So I'm going to have you do flexion. Okay, now do extension. And then hyperextension is put your fingers up a little bit. Perfect. So now we're going to do adduction, so make a fist. And then abduction is spreading your fingers. Okay, so now we're going to do this with resistance. So first when you do your abduction resistance, do not let me press your fingers together. Do 2 fingers at a time. Okay, perfect. So now I'm going to have you do adduction, make your fist. Okay, do not let me pull your fingers out. Don't let me pull them out. Perfect. So now we're going to do flexion. So we'll just bend your fingers. Okay, do not let me pull your fingers out. Flexion, don't let me pull them out. Okay, extension. Okay, don't let me press them down. Don't let me press your fingers down. And then hyperextension. Don't let me press your fingers down. Okay, and don't let me press your fingers down. So client has full and active range of motion of the fingers with resistance of 5. So now I'm going to have you turn and lay down, and we'll begin with your lower extremities. Okay, so I'm just going to move your drape up to your upper half of your body. so that I can keep you covered with privacy. But now we're going to be doing your lower legs. So first I'm going to do inspection. I'm going to inspect your trochanter, upper legs, your knees, your lower legs, your ankles, your feet, and your toes. So I'm just going to walk around and do a general inspection. Perfect. So I can see that the lower legs, they are symmetric. They are the same shape. There is no malalignment of the lower legs. There is no visualized difference in shape. The legs do not appear to be different lengths. There's no rashes or lesions. The color is consistent with the rest of your body. No deformalities, no abnormalities. There's no areas of skin breakdown. So now I'm going to do some palpating. Let me know if there's any pain or tenderness. I'm going to also palpate your feet and your toes. Okay, any pain or tenderness?
Nope.
Okay, so I'm going to be washing my hands since I just touched his feet. Okay, so now we're going to begin with range of motion of your hips. So first I'm going to have you do flexion. So I'm going to have you bring your knee to your chest. Yep, and then extend. Same thing with the other one, knee to your chest, extend. Perfect. So now we're going to be doing abduction. So I'm going to have you bring your leg all the way out like this. So keep it straight and then bring it all the way out. There we go. So abduction, now bring it back in. Okay, abduction with this leg. Perfect, bring it back in. Now we're going to be doing adduction, so I'll have you take this leg and cross it over that leg. Perfect, adduction. Okay, bring it back. And then same thing with the other leg, adduction, bring it back. Now we're going to do internal and external rotation. So I'll have you put your leg on the bed like this with your foot flat. Perfect. So for internal rotation, move your knee towards me. External, move it towards the wall. Okay, now same thing with the other leg. Yep, external rotation towards me, internal rotation towards the wall. Okay, so now you can put your leg down. Now we're going to be doing it with resistance. So I'm going to have you do flexion with your knee. So bring your knee to your chest. So I will be stabilizing his hip. Okay, now don't let me push down. Okay, now extension, put your leg down. So I'm going to be stabilizing his hip. Okay, don't let me bring up. Perfect. Okay, now we're going to do flexion resistance with this leg. So bring this leg. Perfect. So I'm going to be stabilizing the hip. Okay, don't let me press down. Okay, now put your leg down for extension. Okay, stabilizing the hip still. Do you want, let me bring your leg up. Okay, so now we're going to do resistance with your abduction. So again, bring your leg all the way out straight, like so. Perfect. So I'm going to stabilize your hip. Don't let me press in. Okay, now we're going to do adduction. So bring that leg over this leg. Okay, now I'm going to stabilize your hip. Don't let me pull back. Perfect. Now we're going to go to the other side. So I'll have you do abduction on this side, so bring your leg all the way out. Okay, and I'm going to stabilize your hip. Okay, don't let me press in. Okay, so now we're going to do adduction, so I'll have you put that leg over this one. Okay, I'm going to stabilize your hip. Don't let me press out. And, okay, perfect. Now we're going to be doing resistance for your internal and external rotation, so I'll have you put your foot flat again like this. Perfect. So I'm going to have you move internally that way. Okay, stabilize your hip. Don't let me press out. Okay, now we're going to do external, so move your knee towards me. Okay, so I'm going to stabilize your hip. Don't let me press out. Okay, so now we're going to do it with your other leg. So internal rotation. I'm going to stabilize your hip. Don't let me bring it out. Okay, other way. Okay, don't let me push in. Okay, perfect. So now we are going to have you lay on your side. And then we're going to be checking for your hyperextension, just range of motion, no resistance. So I'll have you extend your leg all the way back. Okay, and then move it back. Okay, now we're going to be doing this leg with resistance. So I'll have you bring your leg out. I'm going to be stabilizing his hip. Don't let me press in. Okay, so now you can flip to your other side. Okay, again, and I'll have you hyperextend. So bring your leg all the way back. Okay, without resistance. Now move it back. Okay, now move it back again. And now we're going to be doing it with resistance. So I'm going to stabilize his hip. Don't let me press forward. Okay, so then you can go back on your back. So client has full and active range of motion of his hips with resistance of 5. So now we are going to be doing range of motion of the knee, but since you're laying down, I'm going to do a couple tests with your knee first. First, I'm going to do the bulge test. So I'm going to stroke your inner knee upwards 4 times. Okay, then I'm going to press your lateral side and look for a bulge. Same thing over here. Stroke upward 4 times. Press in. Okay, and there's no bulge, so it's negative bulge test. Now we're going to be doing the Blotman test. This will be testing for large amounts of fluid in your knee. So I'm going to milk your upper thigh down. I'm just going to hit your patella. Okay, your patella is firm and hard. Same thing with Missy. I'm going to milk it down. Okay, so your patella is firm and hard. There's no sponginess bilaterally, so that is a negative Blotman test. Now we're going to be doing the McMurray test, and this will be testing for like a torn meniscus. So what I'm going to do is I'm going to have you put your knee at a 90-degree angle. Okay, I'm going to internally rotate your foot and then extend. Any pain or tenderness?
No.
Okay, we're going to do it again. Now I'm going to do rotate your foot externally. Any pain or tenderness?
No.
Okay, so again, right degree angle. I'm going to move your foot in, extend. Any pain or tenderness?
No.
Okay, so we're going to go one more time. I'm going to rotate it externally, rotate. Any pain or tenderness?
No.
Okay, so that is a negative McMurray test. So now I'm going to have you just swing around, and I'll have you put your legs on the floor just like they were earlier. Okay, and I'm going to keep your drape up here. If you want, you can cover your upper half of your body. But I'm going to still be looking at your knees. So now we're going to be doing range of motion. So you're already in flexion, so I'm going to do extension, so kick your legs out. So extension. Okay, now do go down for flexion. Okay, so now we're going to be testing against resistance. So I'm going to stabilize your knee. Okay, so don't let me press up. Okay, I'm going to stabilize the knee again. Don't let me press up. Okay, so now I'll have you do extension. Kick your legs out. Stabilize your knee. Don't let me press down. Okay. I'm going to stabilize your knee. Don't let me press down. Okay, so you can relax. So client has full and active range of motion of the knees with resistance of 5. So now we're going to be doing your ankles, so you might have to scoot back just a little bit. Okay, so I'm going to have you do plantar flexion, so move your feet towards the floor. Dorsiflexion, move them towards the air. Okay, now I'm going to have you do inversion, so I'm going to have you move your big toe pointing towards the sky. So here's your foot, and then move it like this. Nope, so have your sole of your foot up. Okay, so now I have you do eversion. I'll have you twist your foot out so your pinkies are up. Perfect. So now we're going to be doing it with resistance. So I'll have you just stay in this. I'm going to stabilize his elbow. So don't let me push. Not stabilize his elbow, stabilize his heel. Okay, so don't let me push. Okay, so now I'll have you do inversion. So put your toes towards the sky. Okay, so don't let me push. Okay, don't let me push. Okay, so now I'm going to have you do plantar flexion. So just move it towards the ground. Okay, I'm going to stabilize your ankle, so don't let me press up. Stabilize your ankle, don't let me press up. Okay, now dorsiflexion, put it towards the sky. Okay, don't let me press down. Okay, don't let me press down. Okay, so client has full and active range of motion of the ankles with resistance of 5. Now we're going to be going on to the toes. So I'm going to do flexion of the toes, so flex your toes. Can't really show you because I have shoes on. There we go. Extension. I'm going to have you put your toes out. Perfect. So now we're going to be testing for resistance. So flex your toes again, just like that. Okay, now don't let me pull out. Okay, don't let me pull out. Perfect. So now I'm going to have you keep your toes in extension. Okay, so don't let me press down. Don't let me press down. So client has full and active range of motion of the toes with resistance of 5. So normally we would go to the spine, but I realized that when I did your range of motion with your hips, I forgot to do the straight leg test. So I'm just going to have you lay on your back. I'm just going to test for your straight leg test. Okay. And so what I'm going to do is I'm just going to be lifting your leg, just like this. And I'm going to be pressing down. Let me know if there's any pain or tenderness. Pain or tenderness?
No.
Okay, so I'm going to have you lift your leg again. And then as I press in, let me know if there's any pain or tenderness.
No.
Okay, so there's no pain or tenderness. So it's a negative straight leg test. So I'm going to wash my hands since I just touched your feet. Okay, and now we are going to be doing an inspection of your spine. So I'm going to have you stand right here at the end of the bed. Okay, and I'll have you turn towards the wall, so I'm going to move right here. Perfect. So I'm going to do an inspection of the spine. I can see that the spine is midline. There is no visualized edema. The thoracic spine is convex and the lumbar spine is concave. So I'm going to have you touch your toes. I'm going to check out your shoulders and your hips and your scapula. Okay, and you can stand up. There's no malalignments of the shoulders, scapula, or the hips, so there was no scoliosis, no kyphosis, and no lordosis. So now I'm going to be palpating your spine. Let me know if there's any pain or tenderness. Any pain or tenderness?
No.
Okay, no pain or tenderness. There was no palpable edema. There's no spasms of the paraspinal muscles either. So now we're going to do range of motion. So I'm going to have you touch your toes for flexion. Extension, stand up. Okay, hyperextension, you're going to do it like a thrust. Perfect. So now I'm going to stabilize your hips, and I'm going to have you rotate your upper body, but do not move your hips. Yep. Okay, so client has full range of motion of the spine. So the last thing I'm going to have you do, I'm going to have you stand at the end of this carpet right here. Okay, and I'm going to stand in front of you. So I'm going to have you walk to the wall, and then I'm going to have you walk back to the end of the carpet so I can observe your gait. Okay, and so the client's gait was steady and coordinated. His toes were pointing forward. His base of support was shoulder width. His stride was medium to lengthened stride. The patient was stable, erect, he was able to bear weight, and he had opposite arm swings. So that is it for the exam. Do you have any questions for me before I leave the room?
I do not.
Okay, thank you.